Great, thank you. It's really a pleasure to be here in Kentucky to see the fabulous limestone cliffs and to be here with the governor, the health commissioner. And I think in our last meeting, we were really privileged to have the health community there, the local health commissioners, and also the private sector to really hear everyone's concern, as well as the higher education and the K through 12 commissioners. We had a really robust discussion, and I think what was really important to me is the honesty and directness of the discussion to really understand what we're seeing in Kentucky and what the governor and health commissioner are seeing and how we can be helpful to change the current trajectory. As you know, we have been going across the United States, starting in the Southwest, working across Arizona, Texas, New Mexico. We've been to Florida, and then we went Louisiana, Mississippi, Alabama, Georgia, South Carolina, and now we've been in, and those are the states that are having a very significant epidemic right now. This current group of states, Indiana, Ohio, Kentucky, Tennessee, and Virginia tomorrow, are the next set of states where we have significant concerns about the rising test positivity rate and the rising number of cases. And it's due to that we wanted to come in person to really discuss what we were seeing and what we think, along with the local and state governors and mayors, what they are thinking needs to be done. What we have recommended is that 100% of people should be wearing masks in any indoor public space. Frankly, people should be wearing masks if they've been in an area where the virus is significant. If they've gone on vacation and they come back, they should wear a mask indoors in their homes if they're in a multi-generational household in order to protect our seniors optimally. We do believe that there are states that do need to close their bars, to decrease indoor gatherings to less than 10, and to decrease social gatherings to less than 10, to really make it possible to control the pandemic before it gets worse in states like Kentucky, Indiana, Ohio, Tennessee, and Virginia. We have another set of states right behind that where we're conveying the same message, because we can see what is happening in the South moving north. And just to be very clear, what happens first with this new movement of cases is young people are often infected first, particularly in the under 30 age group. They go on to infect unknowingly, most of them are asymptomatic, they go on to infect their parents, who then infect the grandparents, who often have significant comorbidities and have a very rocky course. And so what we're trying to prevent and proactively go from state to state. I know many of you know we've been sending out reports to governors and health commissioners over the last month. This Monday will be our 5th report. We are hoping to make that public. We wanted to make sure that governors and mayors and health commissioners had that for a period of time, understood what we were trying to say before we put it into the public arena. But I think there's been a real cry to be able to see what we're seeing on the federal government level. In that report, we clearly state which counties we're concerned about in the state. Both the counties that we believe, we call them the COVID red zone, have more than 10% positivity in their test positive, and the yellow zone, those areas that have between 5 and 10%. And this is comprehensive: rural counties, peri-urban counties, and urban counties. That's what distinguishes what we're currently seeing across the United States, is this current wave of infections is very much across the state, probably due to people being exposed unknowingly when they were out and about, who have then brought those infections back to their homes and back to the counties. In the first phase, we saw very much the epidemic very much concentrated in large metros and the bedroom communities around those metros, as well as outbreaks in very specific entities like nursing homes, meatpacking plants, places where there was congregate living. This spread is very much at the household level. And I think that's why we have a real call to action for every Kentuckian to wear their mask and to protect those in their families by not going to large social gatherings. And if they do, to make sure they're protecting those in their families that have substantial vulnerabilities that we know are related to obesity, hypertension, diabetes, and chronic lung, heart, or kidney disease. So I will stop there and see if there are questions.
Perfect. Okay, please raise your hand and I'll call on you and we can go from there.
Debbie Yetter from the Courier. As the cases increase around the country, are you worried about the length of time it's taking to get test results? And how is the federal government allocating testing supplies such as reagents?
Great question. So I think there's three parts to that. One, we've worked hard to extend and expand our current platforms of test. And I think you can see over the last 4 to 5 months, we've gone from less than 2,000 tests a day to almost 800,000 tests a day. And that was utilizing our current platforms. Those are the Roche platforms, the Abbott platforms, the Hologic platforms, the Thermo Fisher platforms. Those are what we consider our high throughput platforms. Those are in our Cepheid platforms. They're often in hospitals and in large commercial laboratories. We've worked with industry to create point of care opportunities, and that is the ID Now, a nucleic acid point of care, and what we call Quidel, and now the Becton Dickinson Veritor, which is very much we're putting into nursing homes over the next few weeks to ensure that every nursing home and long-term care and assisted living facility can routinely test their staff to protect the vulnerable. We will continue to work with industry and with our researchers around the United States to expand to new platforms. But for the last 2 to 3 months, we've been calling for two things. Pooling. What does that mean? That means in a place like Kentucky, we take samples when they come into the laboratory, and we take 4 samples and we combine them together and run them as one test. If that pool is negative, all 4 of those clients are negative. If the pool is positive, you have to go back and test the individual 4. We think in places like Kentucky that could increase your throughput and decrease your turnaround time remarkably and across the United States. Finally, we're working with universities, and I think we have been calling on universities to turn on their research equipment to support the national effort to expand testing. And about 5 weeks ago, we posted a testing strategy addendum on our White House website that says, please, universities, turn on your research, bring your researchers back, bring your lab technicians back, and really turn on this research equipment to be able to dramatically increase the amount of surveillance testing that can be redone for returning students at the university with support to community colleges and K through 12. And so we had that in our discussion, again, asking for that same piece, because we think that kind of surveillance testing is really critical in addition to the diagnostic testing that you have here now and the nursing home testing that we're supporting federally. So we gave them the same set of recommendations that we've had in the report for the several weeks about really mandating masks, increasing the call for social distancing, closing bars, restricting indoor dining, and really ensuring that the citizens of Kentucky do not socially gather in basements, living rooms, and outdoors to really decrease the spread of this virus. There is a way to get this virus under control so that schools can open safely in Kentucky. But it will take all Kentuckians to make that their top priority. We think it should be a top priority that our students are in school, whether it's K through 12, community colleges, or universities. But it is going to take all of us self-sacrificing to wear masks, to make sure that it's not an issue no matter where we are, and to really work hard to protect people at home if we've made a mistake and gone someplace where there could have been large gatherings and large individuals. And so each state needs to make that decision school district by school district to ensure that the virus levels in that school district are low. And we think every governor and every school district has the ability to get there if they follow these simple guidelines.
You've called Florida part of the three New Yorks that were getting worse and worse. Governor Beshear did the travel advisory there. Would you also discourage Kentuckians visit Florida? And do you think we need to take further action?
Well, I heard a very interesting dialogue from the governor and your health commissioner who felt that a lot of the new infections that the state was experiencing were coming from people on vacation that had gone to either Myrtle Beach or a coastal community, whether it be in Alabama or Florida. And I think every Kentuckian should know where there is virus right now. Now, we have traveled the country into major hotspots, and I am still negative. So you can travel if you're super careful. But that means when you're there, you're not going to bars and crowded settings, and you're not going into large social groups where infection can be spread. So it is possible to travel safely, but you do have to take a level of precaution, and those are all on the CDC website on how to travel more safely.
Doctor, there have been some complaints, I think you say, in the past, or at least talk in the past, that the message from Washington has not been very unified, and that's what caused different states to have different issues and a hodgepodge, regulations, and what have you. Are we looking at perhaps the start of a new unified approach to this?
Well, I think that we made it very clear. I've only been in the White House since 1 March, but I know since I was there, we've been very unified in the message, from Stop the Spread message that went out for 15 days that said every American needs to do this, extended for 30 days. And I think collectively, as an American people, we were able to stop the spread. Around the middle of April, we issued federal guidance to every single state of how to open safely, calling Open Up America Again. And it was in that construct that we made it clear about, as you open serially, different opportunities for people to be out and about with clarity on what is safer than others, that you had to really constantly follow your test positivity, your cases, your hospitalizations. And I think when we reflect back, we will have to look at every single state to see if they followed that criteria. But I will tell you, on that Opening Up America Again, it did talk about the importance of face coverings on page 1 as what an individual should do. And so I think the guidance was out there. I think your question is, could we have been more constantly direct after it was published? And I think that is part of the reason why the administration wanted me to come out to states to have that dialogue directly, governor by governor, health commissioner by health commissioner, private and public sector together, to make sure we were all interpreting the guidance in the same way and all interpreting the governor's reports in the same way. And I can tell you that here, the governor and health commissioner and the federal government in the report are on exactly the same sheet of music.
So, bottom line question is Kentucky in a red zone or a yellow zone? The way I see it, there's two measures. One is cases per 100,000, as well as the positivity rate. We hit the cases per 100,000, but not the positivity rate. So what does that do to our to your recommendations for Kentucky and the strength?
So we do have some specific counties and some specific metros in what we call the COVID red zone. We have another whole set of counties and metros in the yellow zone. As a state, we have the state, because I just reviewed it this morning for the next report, in the yellow zone, with clear recommendations of what to do to prevent becoming a statewide COVID red zone. And I think that was the part I was talking about, that the governor and I agree completely on the steps that need to be taken for every Kentuckian to be safe.
Just so that I understand, you're saying bars and restaurants, basically bars need to close down now, and restaurants need to drop their capacity right now.
That was my recommendation to the governor, and I think he sees it the same way. Now, let me subtract out outdoor dining and distant outdoor dining we find to be a safer mode of dining. So if you can create more pedestrian areas where you can expand outdoor dining, I think that is very helpful to the citizens of a state. And so part of the recommendations are also increase the opportunity for outdoor dining.
Your notes? Last question.
We continue on this trend as Kentuckians and not progress. Do you foresee Kentuckians going back to where we were in March and April, shutting down business, people working from home?
I think you are very early, and that was part of this discussion, is how does Kentucky keep from becoming like one of the southern states? And I always want to be very clear, this is not a criticism in any way of the southern states. What they are experiencing is very different than what was seen in March and April, because it started very much as positive cases in the 20 to 35-year-old age set that have very much asymptomatic. So people weren't showing up in the emergency room or hospital. They found it through testing, and that's why we think testing is very powerful. We think in the evidence that is now being gathered from places like Arizona, where the governor did close the bars, did put out a mask mandate for the hot counties, did reduce indoor dining, did expand outdoor dining. We're seeing, and I think you've heard from the national media, really some plateauing and declining of new cases in Arizona. So we believe, and they had test positivity in the 20s. So we believe a state that has test positivity somewhere between 5 and 7%, like Kentucky, has a real opportunity to get ahead of this so that that specifically will not and should not happen.
Awesome. Thank you guys. Appreciate it.
Thank you. It's great meeting all of you.
Well, thank you all for being here today. We had a productive meeting. First, an individual meeting with Dr. Birx, one of her staffers, and then Dr. Stack, myself, and my Chief of Staff, Latasha Buckner. What we see is that the federal government agrees with the steps that we have taken and the reasons that we took them. Knowing that we had an increase of cases, they are highly supportive of the facial covering requirement. They are also very supportive of our reduction of social gatherings to 10 people or less. Now, our numbers still are going up, and so tomorrow you can expect us to take some additional steps. The White House has provided some clear guidance on what those steps should be. Our public health agrees, and we'll have an announcement on that tomorrow. So with that, I'm happy to take any questions, and I never thought I'd be doing it between two ferns. See, he has a little bit of a sense of humor.
So it looks as if the cases are not going to come down tomorrow, as you would hope.
That's right.
And what do you say, it's been July 10th was the mask order. Obviously, they haven't come
Right.
down yet. What do you say to the naysayers that says, oh, those masks, they don't matter. Look, he mandated them and we're still high.
Well, every public health expert, from Dr. Birx, who was here, all the way down to Dr. Stack, will tell you that they can scientifically prove that wearing a facial covering, wearing a mask, keeps you safer and reduces the spread. They're already seeing data from the states that were hit especially hard after that mandate went in. You see a leveling off, and I think they are hoping that you will see a decrease, but it does take time. We are just 16 days after, and so what I know is that we will either see a change in the numbers, or my goodness, our numbers would have been much worse. And so I think if you see us stay where we are right now, it says that we were going the way of Florida and Alabama and others. Debbie? So the roundtable was a group of city and state leaders. We had Dr. Stack, we had our chief epidemiologist, we had the CEO, Kevin Nolan of GE. We had representatives from Norton, Baptist, and St. Elizabeth. Susan head of Toyota, was there, and a number of others. And it was CEO of Lexmark, just an opportunity, and we had representatives from local health departments. And so it was a way for people to get their questions asked and answered, and then talk about what our experience is, because that data's got to move both ways.
Can you give us any kind of hint of what you're going to announce tomorrow? Will it be restaurants, bars, and will there be more?
Well, I think what you can expect tomorrow is steps that we have said that we're going to have to take if the numbers didn't start coming down. And then we're also probably going to comment on where we think we are as far as public schools at that point. Well, I think it's really important when we take those extra steps to be able to communicate with people directly, and we'll have an opportunity to do that tomorrow.
How difficult is it to make wearing a mask a law?
Well, we've done it. And so the question isn't how the difficulty isn't actually putting in the mandate. And I will tell you, the number of people wearing masks has significantly gone up since that happened. The harder part is encouraging everybody to do it. And while we've gone from probably a low percentage of people wearing them to a high percentage, we need to do better. And we need to make sure people are wearing them in circumstances where we kind of let our guard down. So right now we've got a good adherence in retail, in restaurants. But I tell you what, I just saw a picture of a couple bars last night in Lexington that have hundreds of people in them, and none of them are wearing masks. Now, that's a problem, right? And that's going to require us to take some steps that we don't want to take. But we're all living for each other right now, and we got a duty to not go to that place. And then we have a duty, if we're at that place, to wear the mask. The business has a duty too, but I mean, come on, we're not playing around with the numbers that we're seeing. Yeah.
For the recommendations that you plan to make tomorrow, is there anyone specifically you plan to talk to before you do this?
Well, we've been trying to do a better job of communicating out to as wide of an area as we can. We'll certainly talk to any association that is related to them. We have been having those conversations. I don't think tomorrow's announcement will be a surprise to anyone. And that's what we've got to be able to do, to set reasonable expectations for folks to know, what steps we'll have to take. But I will not let us become an Alabama, a Florida, or an Arizona. We got to take proactive steps, and that's what we're trying to do.
Going off the bar comment that you made with the picture, I've seen the same situation at sporting events. Do you expect to also tighten restrictions on other things like that in addition to bars, restaurants?
Well, I think the steps that we're going to take tomorrow are steps that the White House and other public health experts believe have the maximum impact. But we've got to get better at every event that we're at. You all know that I had a sporting event that I went to that I didn't feel was safe. I didn't intend it to be a big media story, but we've all got to get to the point where if we show up and we see something that doesn't look right, we go home. That should be a bar, that should be a restaurant, that should be a retail facility. Sporting events, we've seen some really good ones. I believe that the soccer game at Lynn Family Stadium, they did a pretty good job. And if we get that type of adherence, we can do those things. But, sports everywhere are in jeopardy right now if we can't get a hold of our cases and the numbers. Anybody else? Shelby?
Dr. Burks talked about doing pool testing in Kentucky. How will you do more of that here?
So we're going to look at pool testing. Pool testing can be really helpful if your demand exceeds your supply. Right now, we've got a pretty good testing capacity. We've got 3 labs in Kentucky that can produce and run more tests than currently we are conducting. Our bigger issue is the logistics piece of it, because you got to get people's information, before they come. You got to notify them afterwards of the test, and then people have to be willing to come and get tested. So we see a lot of demand in Louisville, Lexington, and in northern Kentucky. But when we set up testing sites in some other places, you see less. Now, we're going to have to get to a point as a state where more people want to come and get tested. And if we need to move to pool testing because of that, we will. But it is a way, especially in the harder hit areas, to test more, but also to turn around the response quicker. For us, our state labs and that is Solaris, Blue Water, and Gravity are all turning around their tests pretty quickly. It's these national labs that are hit so hard. All right, thank you all very much. Have a good Sunday. Between Two Ferns.